Mr. Chairman, ladies and gentlemen, Francis Collins is a famous physicist and a devout Christian. He has written a wonderful book called Language of God, in which he says that if we compress 4.5 billion years of Earth into a 24-hour cycle, various forms of life, they appear at various stages, whereas the humans are just 3 seconds old. And it is not surprising that with this young age, humans find it difficult to come to terms with how life has evolved. And with evolution, medical profession has also evolved. We used to think that illness is an act of God which struck at random. Well, it is still an act of God. We all believe that. But probably we have started to understand God's ways a little better now. We are more aware. There are enhanced expectations. And we are investigating more to rule out diseases than to investigate them. Doctors have always had a sense of entitlement, that because they are a noble profession, so they deserve respect. And it's a moral superiority which doctors have come to claim. And you must have heard that are you the doctor or am I the doctor? The doctor knows best. And that is how, over the millennia, practice of medicine continued. The patient showed unquestioning loyalty to the doctors who would be resplendent in white coats and do the ward rounds over the decades and decades. But something happened over the turn of the century when the patient in the ward, he decided to get up from the bed. He went to the library, he went to the internet, he read books, and then he confronted his doctor and said that now I am no more a passive recipient of treatment. I want to be an active partner. So nothing about me without me, but please don't confuse it with mera jism, meri marzi. Now, we are living in unique times. It's probably unprecedented in history that there are several groups of people who have got different value systems and who are working together. I think, yes. So there are many people, and we can classify them as traditionalists who were probably our parents, and there are very few left now in the workforce at least. They were totally committed to the company and unquestioning loyalty, and they would go down with the ship. Then came the next generation that probably we belong to, who are fading fast now, who were workaholics, used to belt tightening, and who would value titles like Sitara Imtiaz and Tamgai Basalat, etc., etc. But that gave way to another generation who give more importance to their career than to their personal lives, and they are not committed to a particular company, and they want rather immediate gratification. Then came the generation called Generation Y. Now they are more liberal now. They want a balance of work and personal life. They want something for their personal enhancement also. They don't expect a job for their lives. And now, as we speak, there is another generation called Generation Z, who were born in 1995, and it goes up to 2010. Now, many of them are coming up, and they have got their own sets of problems. But now the question arises that how these varying groups, they interpret professionalism, particularly medical professionalism. Now, Socrates, he asked his student Thrasymachus that who is a doctor, the one who earns money or the one who treats the sick patients? And Thrasymachus' answer was quite obvious. Now, there are now some generational differences, which now we need to take into account to reach a definition which is acceptable to all the age groups. Presently, Pakistan undergoing an identity crisis. A generation of young people have almost revolted against the existing decadent order. And one generation is finding it difficult to find out the undercurrents and the cross currents of various society. And with the intellectual limitation, they are finding it difficult to give it names. And that is how they at times denigrate it or give it wrong names as well. So what's a profession? Let's just try to define and differentiate it from an occupation. What's the difference between the two? Now, a profession is an occupation which regulates itself through systematic and training and collegial discipline. It has based in technical knowledge rather than a profit orientation. Can we have some quiet here? All right. So, professionalism is then often the basis of, a code of ethics is the basis of professionalism. Now, it is not that we do a particular type of job. It is that we are a particular type of a person. So if there is a doctor and he says, I am a doctor, that means he is not just a doctor who practices profession, but he's a doctor who is a particular type of person as well. Now, today, at the dawn of century, genuine medical professionalism is in peril. Now, that brings us to another question, that once the patient he wants to be counted, then is he a consumer? No, that's a great question that is staring at us. That he is no more now, he's a subject of unquestioning loyalty. He wants to be treated as an equal. So in the workplace, he becomes a consumer whose purpose is to purchase. Once he wants to purchase, then nobody is the king. There is no superiority for the doctor or centrality of the patient. But is this workable? A better metaphor might be a double helix that you can see in the background, whose two strands encircle each other, or to return to medicine's roots, the caduceus, whose two serpents they intertwine together forever. Doctor's role has actually expanded. Now, a doctor is not just a person sitting in a room who is dispensing medicines, but now he is an active member of the society as well. Various factors are influencing the doctor, and doctor is in turn influence the society as well. WHO thinks that a 5-star doctor is not just a care provider, but he's a decision maker, communicator, health advisor, and a team member as well. Now, with this background, let's see that what are the challenges to professionalism in the modern era. Now, there are some things which will never change. A professional will always have to be competent. He will have to have an ethical base. He must be a man or a person of integrity, honesty. People should be able to trust him. But where the professionalism is getting modified, now from internal self-regulation to it is openness and accountability. No, we can't be tribes, Doctors can't be a tribe. Lawyers can't be a tribe. Military can't be a tribe that they can just internally self-regulate. Now you have to be open to the society. Now you have to be accountable to the society, including doctors and everyone else. So is the professionalism changing? Yes, of course it is, but it is still at the core of what it means to be a doctor. Now, there's another aspect to professionalism, that is the relationship. It is not just the relationship with the patient. It is relationship with the knowledge. It is relationship with the patients. We'll talk more about that. Relationship with colleagues and relationship with society and capacity to introspect whether these relationships are all working properly or not. So good medicine is relationship. which is at the heart of the medical professionalism. Can this be taught? Yes, it should be taught and it must be taught. Now, there's some core challenges that to the modern medicine is that we are all fallible. We can all make mistakes. And it is said that in the best ICUs of the world, there are 6 very serious mistakes done every day per patient. But still, the benefit is so overwhelming. But we must share with the society our vulnerabilities and our fallibility. Medicine is too uncertain, and there are risks involved, and we need to develop a shared understanding with the society. So the paradigm has shifted from individuality to mutuality, because now it is not a one-man job, it is a teamwork. No doctor with all the brilliance in the world can deliver the goods unless he has a good team, he or she has a good team. And now from self-regulation to shared regulation, and from centrality of the doctor, it is time that we think of centrality of the patient. So we talk a lot about patient-centered professionalism. What is, after all, a patient-centered professionalism is where patient is the center of your universe. Your patient must be satisfied. Your patient must be compliant. And it is said that a good doctor and a bad doctor are differentiated, that whose patient are more compliant of the treatment. Compliance is not an issue of the patient. Compliance is an issue of the doctor. Now, patient-doctor relationship. It's such a wonderful, strange relationship when 2 complete strangers, they enter a room, and a stranger become my patient. And he remains my patient for the rest of his life. He will see you in the airport, he will see you at the railway station, he will flock to you and say, he's my doctor, and you will own him and that he's my patient. So it's a wonderful relationship. And then trust. Ladies and gentlemen, we lay bare our bodies in front of our doctors because we trust them. But be assured that laying bare body is easy. Laying bare your soul is much more difficult. But our patients lay bare their souls and their bodies to us. And betrayal of soul and betrayal of body is the betrayal of the worst kind. Now, niceness, I don't need to say anything. Undivided attention, yes. I mean, in this era, medicine is too serious a business to be done with half of the mind. And we have talked about this before, that taking several phone calls during consultation is, I would think, it's a slanderous and even blasphemous. This is absolutely insult to the patient. It dents the patient's trust irremediably. Right. So when we talk of patient-centered professionalism, now patient and relationship with the patient is the center of our universe. But have we ever tried to understand our patient? Who is the patient? What is his psychology? Now, in the outpatient, a person comes who has had pain all night, and he has dyspnea, shortness of breath, and he has been running fever. He comes to the hospital, and we don't know, but hospitals are frightening places. People are lost, they are being misdirected, and they can't find the person whom they want to meet. And the patient, when he comes, his internal milieu has been altered by pain and disease and sleep deprivation. He is afraid that he has coughed blood last night. What could be the reason? He's afraid of coping. He thinks that, he might not live. And he is afraid that he will not be listened to. And many people come and they tell you that, Dr. Saab, pehle meri baat sun le, because we are too ready to write a prescription before even listening to. Some patients develop a sense people who develop tuberculosis, heart disease, and diabetes, they think that they have failed themselves. They have failed their family. I remember a very senior officer who had triple vessel disease, and we referred him to another bigger center, and he said, my colleagues will laugh at me. So a patient is very vulnerable, and we must understand his vulnerabilities. Then there is a primitive reaction of the humans to illness. We know that sick cows, they are kicked, jostled, and even kicked by the herd. And that psychology still is fresh in the mind of many human beings as well from evolution. Now that was the commitment for 2 hours or so in the outpatients. But when you admit the hospital, what goes through his mind? That a hospitalized patient, he has now communal living. All the batches of his identity have been removed. It's an open-ended time commitment. All his routines are suspended, and he's just become a bed number or a room number. When visiting hours are finished, he's lonely, all with his dark thoughts. He doesn't know what is going to happen to him. And when the doctor comes in the morning, be assured that he is trying to listen to his footsteps. He is keenly listening what the doctor is telling to the other patient. He is very apprehensive that his biopsy report is coming, how his life is going to change forever when the doctor breaks him any news. Then in the hospitals, the patients are wheeled into the dark rooms where people with masks and in caps, and they are there. Their various lights are blinking. There are beeping sounds and alarms, and it's a strange kind of a surreal atmosphere. And at that place, only one voice gives him assurance when his doctor says that Mr. So-and-so, everything will be all right. He clings on to that. He wants to listen to that voice. And that is what I say, that who owns the patient? There must be one person who owns the patient. And he then relates with the patient, and patient is desperate to listen to that voice. Now this area, the most challenging area, is the one in which medical professionalism is involved in the terminal care. Medical professionalism is sorely tested here. Now, let me briefly touch upon the relationships, that various relationships that people have. And I believe that a mother and a child, their bonding is the ultimate relationship, which is actually the sustainer and guarantor of life of our species on this planet. Now, let me take you to the rural Wales for a few seconds, where a mother and a child, they had to go to a village across the mountain pass, and there was a snowstorm. They were stranded, and next day what people saw was that the mother lay frozen to death, and all his clothes, her clothes, they were the child was wrapped on all those clothes. But there are other relationships. I just, in the interest of time, I would just add soldier, a wife who was dying in Combined Military Hospital, Multan, and he wanted to say a final goodbye. And he went and kissed his wife on the forehead, and 2 tears, they trickled down his cheeks. Our nurse, she thundered down the aisle to stop him from this act of obscenity, which I told her to give respect to this moment. And ladies and gentlemen, the profound events that are taking place behind the closed doors, behind those curtains, apologies are being sought, lifelong and love affairs are coming to an end, and that is the time when we must show sensibility to their sensitivities, and we must be emotionally sensitive. I would end by saying here that death is not enemy of the patient always, and it is not the defeat of a doctor. Painless death is the legitimate goal of any compassionate medical profession. But we must never say that nothing can be done. Even in suffering from an incurable disease, something can be done. And the patient should be able to say that that person, that doctor was lovely and kind. He really made a difference. And when you will be driving back home that evening, maybe you would think that after all, it is good to be a doctor. Thank you.